Hi, my name is Vanessa and this is my colleague Dominique. It is my absolute pleasure to welcome and introduce you to North Metro Health Services Mental Health Transition to Practice program. We begin by Acknowledgement of Country. We acknowledge the Noongar people as the traditional owners and custodians of the land on which we work and pay respect to elders past and present. North Metro Health Services recognises, respects and values Aboriginal cultures as we walk a new path together. I'm just going to go through a quick overview of the session. We will be looking at mental illness and prevalence in Australia. We're going to look at what is mental health nursing, and we will do an overview of mental health transition to practice program. So how come mental health is common? What is mental health? Who defines mental health as not only the absence of mental health disorders? It involves the state of well-being where the individual recognises their abilities and are able to cope with stresses of life. Work productivity contributes to and be able to contribute to the community. Mental illness is a general term that refers to a group of illnesses in the same way that heart disease refers to a group of illnesses and disorders affecting the heart. Mental health is a key component of overall health and well-being. How common is mental illness? 1 in 5 Australians aged 16 to 85 experience some form of common mental illness in any year. That can be anxiety, depression, or substance use disorders. This is equal to 3.2 million people. Most of us will experience a mental health problem at some point in our lives. Over the last decade, the number of nurses working in the mental health sector has increased by 50%. The Australian Institute of Health and Welfare ranked mental illness as the third biggest source of disease burden in Australia after cancer and cardiovascular disease. The graph indicates a disease burden for various categories of illness. Mental illness is a significant burden for Australia in terms of health outcome, quality of life, co-occurring illness, death and disability. It impacts on the individual's family and communities and poses significant economic and social cost to the nation. To add to the burden of disease is COVID-19's impact with additional staggering effects on mental health due to changes to daily life, for example, loss of jobs. Recent studies have shown global increases in the prevalence of severity of depression and anxiety, as well as an increase in post-traumatic stress disorder and substance abuse. Following global pandemic, therefore, increases in the workforce is needed, particularly in this speciality. It is one of the strategies to address the pandemic's rapidly increasing mental health burden. This slide illustrates how physical illness can manifest following mental illness, that the body and mind are actually connected. So what is mental health nursing? Mental health nursing is a specialised branch of nursing with a focus on the care of people with mental health problems. Mental health nurses work with patients or clients to promote psychological, emotional and physical well-being, whether it be working with patients or clients to understand their mental health conditions, to learn how to manage their symptoms and be aware of what can exacerbate their mental health conditions. As nurses, the provision of holistic, person-centred care nursing is the approach that we like to take. Working with multidisciplinary teams, which include mental health advocates, peer support workers, the patients themselves, and their nominated support persons to formulate, implement, assess, and reflect the best individualised care plan for each client. Teamwork is one of North Metro's values. That is quite important when we're doing our job. Working in many different environments, both in patients and communities and in people's homes, there are expanding levels of experience in mental health settings to be gained. Opportunity to consolidate basic and advanced nursing skills, assessment, interpersonal, interprofessional and clinical observational skills, and a variety of screening tools to be used. Enabling recovery through provision of trauma-informed care, recovery-focused interventions, use of strength-based planning, provision of counselling and motivational interviewing. One of the main concerns is around losing already acquired nursing skills in mental health settings. However, it is really important to note that people living with mental health illnesses have high risk of experiencing a wide range of chronic physical conditions. High rates of diabetes, heart disease, and respiratory conditions in people with mental health illnesses have been well established by research. Studies suggest that people with mental illness are more likely to develop physical illness due to a combination of lifestyles, socioeconomic, and system-level factors, such as social stigma and medication side effects, which can include things like weight gain and hyperlipidemia. Mental health is a key component of overall health and well-being. People with chronic physical health conditions experience depression and anxiety at twice the rate of the general population. So why choose a career in mental health? Mental health nursing allows you to build knowledge, skills, and confidence. It is challenging but hugely satisfying and rewarding with a great job satisfaction. Working in mental health, you are working with individuals with different backgrounds, needs, and goals. It is essential to build therapeutic rapport with them to enable us to work collaboratively to support them in their recovery journey, however recovery looks for them, as that is also very individual. This slide here shows the skills that you will utilise in your personal life as well as at work. In mental health nursing, you will become an expert communicator with clients, colleagues, family and friends, and the community members. You will become more resilient and having more compassion and empathy. You'll become an expert in de-escalating potential conflict. You will build excellent teamwork skills, including those working with a multidisciplinary team. You'll become an expert in adapting and reacting quickly to challenging behaviours. You will gain an approach to day-to-day life with more self-confidence. You'll become great at problem-solving, critical and logical thinking. And you'll be able to build a self-awareness and use of effective communication techniques. So we'll start looking at some of our career pathways. Mental health is a growing sector in nursing. There's lots of job security being created. There's unlimited career opportunities within this speciality area. And I'd like to just include that currently North Metro is undergoing some planning for expansion in the near future. But at the moment, I'll just hand you to Dominique to tell her story about her career journey in mental health nursing.
Thanks, Vanessa. Hello, my name is Dominique. Currently, I'm employed with Mental Health Public Health Dental Services as a staff development nurse, but as you can see from the slide above, my career in mental health nursing began as a graduate registered nurse. The graduate program allowed me to gain experience across a variety of settings such as older adult, and forensic services. Within that time, I was supported by a wonderful multidisciplinary team as well as a professional education department. Following my graduate program, I gained employment at Greylands Hospital, where I worked in both adult acute and hospital extended care services. After a short time, I gained experience as a ward coordinator, and from there, through expressions of interest, this enabled me to gain a variety of other perspectives as I took on the role of clinical nurse manager, clinical nurse specialist, SRM1, and opportunities to cover in triage. The opportunity to work in a variety of mental health settings is vast, and the ability to take on different roles is encouraged. So as you can see, there is a multitude of pathways for your career to take. So thank you, Vanessa. I'll pass back over to you.
Thank you, Dom. Okay, so up on the screen at the moment, that is my career path since I commenced nursing and working in the mental health industry. As you can see, I did actually begin as an enrolled nursing student, and I commenced my transition to practice program based at Greylands Hospital as an EN. I then went on to study my registered nursing, and then from there I actually took on another transition to practice program through Sir Charles Gardner and King Eddie's. Through those life experiences, through those rotations and ongoing job opportunities that I gained in my early years, I then went on to do other jobs that you can also see there. I did some triage nursing. I did some dabbling in bed flow. I've worked in youth mental health services, older adult mental services. I then went on to study more and I became a trainer and assessor for the vet sector, working to do clinical facilitating and also lecturing for some of the TAFEs. I've then gone on to do some community mental health nursing. I've worked in perinatal mental health nursing as well, so as you can see, lots of different avenues in mental health. And currently I'm doing my staff development nursing role at present within North Metro. So to move on to the nitty-gritty about the Transition to Practice program within North Metro, let's have a look at how we can support you to achieve your dreams. North Metro Mental Health currently offers 2 mental health and 1 collaborative transition to practice program. However, we will primarily be focusing on the RN and EN transition to practice program. More information regarding the collaborative graduate program will be provided in the Sir Charles Gardner Hospital presentation. Transition to Practice program is a program that supports graduate nurses in clinical areas and assists in becoming confident and skilled in this speciality area of mental health. North Metro Mental Health is a health service with a catchment area of almost 1,000 square kilometres and focuses on engaging workforce, embedding a healthy organisational culture, provides person-centred healthcare. We have over 15,000 mental health patients. Our area of speciality is mental health, and the Transition to Mental Health Nursing program plays an integral role in the nursing workforce at North Metro Mental Health Services Mental Health. This slide gives you a brief overview of what the program entails. You will see that you will have a 1-year contract of employment, 2 6-month clinical area rotations allocated based on preferences. There are some 6-month placements with 2 rotations, but predominantly there are 12 months long contracts. You will get a study block including a service induction, mandatory training and professional development. There's excellent support from experienced mental health nurses and educators, access to clinical supervision and reflective practice. Registered nurses can undertake a postgraduate education with a scholarship for 2 funded units. There will be rotational nursing rosters, which may include day, afternoon, and night shifts. And you'll also receive supernumerary clinical practice at the commencement of each clinical rotation. The next slide is showing the participating sites within this program. Like I said before, the program will include 2 clinical rotations across the following sites. We've got Greylands Hospital. Greylands Hospital is the state's only standalone public psychiatric teaching hospital that provides acute care and extended care for those needing long-term inpatient support. We've got the State Forensic Mental Health Services, which is co-located on the Greylands Health Campus, including Franklin Centre for people with mental illness within the state's judicial system. Sir Charles Gardner Hospital Mental Health Services includes a mental health unit and the MOA, which provides short-term admission only via Emergency Department of Assessment and Treatment. We've got the older adult mental health services, including Osborne Park and Lower West, which is also known as Selby, which provides services to people older than 65. As you can see, North Metro has quite a broad experience to offer you. And before you see some testimonials, there's always been rumours that Greylands is shutting down, but in fact, North Metro is currently, like I said before, undergoing future planning and expansion. Greylands is currently going through some configurations, and the Franklin or the Forensic Statewide Services, they will be looking at expanding soon. So right now it looks like a great time to set foot into North Metro Health Services Mental Health and get your career started in the mental health industry. I will just give you a moment there to just read some testimonials for yourself from previous Transition to Practice program graduates. Great. Here are just some references of what we had to use for our information to provide you. And lastly, I just want to thank you for your time. And if you have any further questions or inquiries and you're not able to ask them today, please look at our North Metro Health Services Mental Health website. Thank you for allowing myself and Dom the opportunity to present and for having us here on behalf of North Metro Mental Health Services. Thank you. Thanks. For a nurse at Franklin and a nurse after, should I bring this to the interview? I have completed some of my training. For those asking about recommendation letters and certificates, everything looks great on paper. Always put that into your applications because that just adds value to a competing market for transition to program slots. Referees, there are processes in place with the recruitment and workforce department in terms of how people will check your referees. Please just make reference on the options that are provided to you for the Grad Connect website. Do we need to specify the hospital still or North Metro? Someone said if we apply for a grad program in mental health, do we need to specify the hospital or just North Metro Health Services Mental Health? We've got a broad range of sites that we work from, and they all have different units with different experiences. So please shoot us a question if you'd like to know more about the individual sites or the individual units, and we will be able to give you a little bit more advice around that. Sorry.
Just apply to North Metro Mental Health.
But just apply to North Metro Mental Health to begin with. Yep. And do I note my preferences at interview? Yes, you do need to note your preferences at interview. There you go. Thank you. Oh wait, there's still more. Anyone who has speciality interests, such as those wanting to go to Franklin, please just make that noted on interview as well, okay? Cool. Hopefully that helps. Thank you very much for hearing us out. Cool. Have a nice day.